It's welcome to the University of Montana School of Physical Therapy and Rehabilitation Science interview day for 2024. So we are excited that you're here. Thanks for taking time out of your Saturday to allow us to get to know you, and then hopefully you'll get a chance to learn a lot about our program as well. So we have a full day planned. And my hope is that you finish the day having a good understanding what an education at the University of Montana will look like, and where it'll leave you at the end of our curriculum. So welcome. We're excited that you're here. So first, I'm just going to go over a little bit of an outline of this morning's presentation. First, of course, the welcome and just overview of our program. So that'll be me. I am the director of the UMPT admissions. I'm then going to hand things off to Dr. Jennifer Bell. She is our director of clinical education. And then at that point, we'll do some questions and answers with the group. So we'll go ahead and turn off the recording then at that point. So however, as we're going along, if you have questions, please feel free to drop them into the chat, and then we can hit those once we get to that time. Of course, you can also ask questions live as well. We'll also go over the schedule for the rest of the day, so you feel good with where you're headed. Yeah, thanks again for coming. So this is what University of Montana looks like, obviously during warmer times. So it's certainly winter in Montana. So the first thing I'm going to do is introduce our leadership. So Dr. Kevin Brelli is our chair and also our program director. As I mentioned, I'm the director of admissions, and I'm also an associate professor. Dr. Jennifer Bell, who you'll be hearing from shortly, she is the director of clinical education. And then Dr. Steve Ferdig is the director of our on-site physical therapy clinic. Our core faculty, we have 14 core faculty and instructors. We have, I would say, over half of our faculty have a clinical specialization that is board certified, either neuro or sports or orthopedics. We also have the majority of our faculty have actually all of us have doctoral training, whether that be a DPT, a PhD, or a DSC. So we feel that we have a well-rounded and highly skilled faculty, and our faculty pride ourselves in having an open door policy for our students. We tend to view our students at the University of Montana as colleagues rather than students, if you will, because when you join us at the University of Montana, the first day in our program is the first day of your professional career, and everything that we're doing is working toward preparing you for entering the workforce as a licensed physical therapist. So why University of Montana physical therapy? Well, we have a small class size. We have 36 students per cohort, and the CAPT average. CAPT is the accrediting body for all physical therapy programs in the United States, is 46 students per class. So we feel that our class size provides an optimal student and faculty ratio. It provides enough students that you have a large variety of students to work with, both on class projects, but also with learning clinical skills. It's, we spend a lot of time working with each other. We all have unique anatomy, unique injury histories, and unique health histories as well. And I think that helps prepare us for our clinical experiences, as well as being a full-time licensed clinician. One of the things that I think makes us special is that we have an on-site physical therapy clinic. This is something that is not a faculty practice. This is actually an integral part of our curriculum. It is a real strength of our program. The physical therapy clinic is on the first floor. It is directly across the hallway from the main office. Our faculty work in our on-site physical therapy clinic, and our students do part-time clinical affiliations there that is part of our integrated clinical experience, which you'll hear more about shortly from our Director of Clinical Education. We have 36 weeks in total of clinical education experiences. This is 8 weeks more than the CAPD minimum. So we feel that this provides our students with the opportunity to get a nice, well-rounded, not just in breadth, but also in depth as well for their clinical education. Some other things that we offer is we offer in the second half of the second year, and also in our third year, the ability for our students to do electives. And what this means is that if you have a very specific interest in vestibular care, women's health, treatment of the injured runner, treating individuals who have neurological conditions, pediatrics, and so forth. Our physical therapy faculty teach very intensive 15 to 16-hour courses where you can get an extra training, particularly if this is something that you're interested in pursuing as part of your career once you graduate. We also offer 2 dual degree options. We offer a Master's of Public Health, DPT, and we also offer a Master's of Business Administration, DPT. We also have certificate programs that go along with that too. So if an MPH, DPT is more than what you would like to do, you can also get a certificate in public health, or you can get a certificate in business administration. We have an information session later today where we have some individuals from those respective programs that will be here to talk to you more about that. If that's of interest, make sure that you attend that session, and I'll talk about that later once we get to that portion of our schedule for the day. So besides education, we have world-class research. We have individuals, our researchers in our program who are funded from various federal agencies, including the Department of Defense, National Institutes of Health, also the Foundation for Physical Therapy. We have very specific research focus areas on vestibular disorders, knee injury, clinical pathways, running injury, geriatric care, care of individuals or pediatric individuals, and also hippotherapy, which is equine assisted physical therapy for pediatric patients. So one of the things I think that is unique about our program is that research for students in our program is not required. It is an option, but we do welcome students who to come into our lab and work and also get elective credits. You don't have to do that, and some programs will require a research capstone that everybody has to do, and we do not do that. However, if research is something that you're interested in, you feel free to ask some questions about that at the end of today's session. We have a block curriculum, which is also a little bit unique. What that means is that we take a semester and we cut it in 2. So we have 2 7-week blocks each semester. What that allows us to do is take a semester-long class and compress it into a single 7-week block. That provides a more intensive learning experience. And within each block, we typically have 2 to 3 courses per block. The nice thing for students is that means that they are only having to juggle assignments for 2 to 3 courses. Same thing with final exams, rather than having 4 to 5 or 6 classes that they're having to juggle assignments. That provides a more intensive learning experience for students. That means that when you're taking a class, particularly a class perhaps has smaller credit numbers, you'll still meet multiple times during the week. So once you come back from back to class, we don't have to spend so much time everybody getting back up to speed with where we left off, and that allows us to focus more on progression of skills. I'll quickly go over our just an overview of our UMPT curriculum, and then I'm going to hand things off to our clinical education team shortly. So we have our program is 2 years and 9 months. And we start typically at the very end of August or the very beginning of September. In the first year, you have fall block 1 and fall block 2. We start off with gross anatomy and as well as biomechanics. Those are the only 2 courses that you take in fall block 1. And then from there, we move on to more specific clinical skills in block 2. After a break, we come back for spring block 1 and spring block 2. And then at that point, students will then go on their very first summer clinical, which is 8 weeks in length, and that is a full-time clinical. After that, students return. We'll repeat the same thing we did in the first year. So fall block 1, fall block 2. Then after a break, spring block 1 and spring block 2. Again, another 8-week full-time clinical. And then back to the University of Montana in Missoula for the fall semester. So we'll have a fall block 1 and fall block 2. But then after the break, students will go on their final 15-week clinical. Commencement is typically around May 8th or so. We allow students to take the National Physical Therapy exam just prior to graduation, which means that once you have your diploma in hand, you will often have your National Physical Therapy examination results, and you'll be able to get licensed and begin working soon after graduating from our program. Okay, so why physical therapy? So we've basically just kind of gone over like all the curricular aspects of it. I think the other things too that I think draw all of us, including faculty and staff here, and I suspect also our students, is the school life balance. So we live right in the mountains, which is really a spectacular place to live. I think every day I kind of wake up thinking how lucky I am to live in Missoula. We live quite close to 2 large national parks, Glacier National Park, as well as Yellowstone National Park. We also have skiing nearby, and so I know just yesterday I was talking with several of our second years, and they were planning on going skiing this weekend. So we have lots of outdoor opportunities that are just right outside our door. Again, our small class size creates an environment of camaraderie and kind of a shared learner approach for our students. So we have a very, very collaborative learning experience that I think that makes our program unique. And so one of the things that we have this afternoon is, or later this morning, is we have a Zoom room with some of our students, and I really encourage you to visit that, stop by. They'll be on hand to talk to you about what it's like to be a student here at the University of Montana. They'll talk about things to do in Missoula, moving to Missoula, what it's like to be a first-year PT student here, and other things like living and so forth. So we have a nice range of students. We also have at least one dual degree student who will be on that call, who can hopefully answer some questions about what that workload is like, if that's something that you're interested in. So our program outcomes, I think, are really, really quite outstanding. We have a 100% graduation rate. And when you look at our 2-year average, it's really, really quite outstanding. And when you look at the CAPTE averages, CAPTE average for graduation is around 89%. So our graduation rate is quite a bit above that. First time National Physical Therapy exam pass rate is 97%. So we typically maybe every year or so, we might have one person who might end up maybe not being on the best on when they go to take the National Physical Therapy exam. But the overall National Physical Therapy examination rate, which is the second time, if someone needs a second time, is 100%. Compared to the CAPTE averages, those are in the low 90s. And our first time National Physical Therapy pass exam rate is for CAPTE is 86%. So we're 10% above the national average. And our employment rate is 100% as well. Okay, so what I'm going to do now is hand things off to Dr. Jennifer Bell, and she's going to talk to you all about our clinical education program.
Right, thanks, Rich. So it's so great to see everyone here. I know I spoke with some of you all last night, but I just wanted to do a nice overview for everyone about the clinical education program. So clinical education is a pretty huge part of the curriculum. It's about a third of the total credits that you'll take and a pretty big chunk of your time during PT school. Like Rich said, we have about 36 weeks of total time doing clinical education. So this is our clin ed team that you see here. I'm the director of clinical education. Dr. Susan Ostertag, she's on the call today. She's our associate director of clinical education. We also have Dr. Jacqueline Carson, who's our site coordinator. So she works with all of our students and manages our integrated clinical experiences that happen here at the UMPT clinic. And then we also have Alyssa Waters. Alyssa is our admin associate for clinical education. And so Alyssa works very closely with students and clinical sites to make sure that students meet all the requirements such as background checks and immunizations and things like that so that they're prepared and have met those requirements for their clinical experiences. Next slide, Rich. So within the clinical education program, we have some specific objectives that we need all of our students to meet. And so one of those objectives is that you will have a breadth of training throughout your clinical education experiences. And so we achieve that breadth of training by requiring our students to all do at least one inpatient clinical experience and one outpatient clinical experience. We also have all of our students through our ICE experiences that happen on campus. They will work with orthopedic patients and then also have an experience working with patients with neurological or complex medical conditions. So you're really getting a broad exposure. You're also working with patients across the lifespan. We need all of our students to achieve entry-level clinical and professional skills through clinical education. And so that's really we're progressing throughout the clinical education experiences to get you to entry level by the end of the final clinical experience that you have. So like I said, we have 36 weeks total. 31 of those weeks are full-time weeks and 5 of those are part-time weeks in the clinical experiences on campus. We had some questions last night about kind of where are your clinical sites and locations, kind of where can I do clinicals? We have over 500 affiliated clinical sites across the country. Overall, the bulk of those are in kind of the Rocky Mountain West, Pacific Northwest, because that's where the majority of our students have come from over the 42 years that we've been in existence. And that's where a lot of our students end up working after they graduate, and then they reach out to us and they say, hey, you know, our alums want to work with our students. And so that's where the bulk of our sites are, but we have sites in all 50 states. And so we really have a wide variety. And so through those clinicals, you're doing 3 full-time experiences and 3 part-time experiences. And we'll talk a little bit more about those now. So this is kind of a outline of all of the clinical work that you'll do throughout our curriculum. So fall of your first year, you're not doing any clinical education stuff, building that foundational knowledge. In the first year spring semester, you'll do a clinical clerkship, and part of that course is kind of learning and preparing for those full-time clinicals, but also you'll engage in 5 hours of community outreach. And we have community outreach embedded across our program because it's one of the core values and responsibilities as a physiotherapist. So we really want to make sure that you're learning how to engage in community outreach. You're starting to identify organizations or types of community outreach that align with your interests and values. And then in the first summer, so you'll have your first full-time clinical experience the summer after first year. It's 8 weeks long, and you will have options to either do that in an inpatient setting, like in a hospital, skilled nursing facility, home health, or an outpatient facility. Some of those are outpatient private practice, maybe hospital-based outpatient. And so you have that in 8 weeks of the summer. Our summers at UM are generally kind of 14 to 16 weeks long, which means that you have anywhere from 6 to 8 weeks of downtime in the summer. So we work with students to kind of figure out if you want to do your clinical the first 8 weeks of the summer or the second 8 weeks of the summer, and then you have the other time off. Then you come back, you have your fall of second year where you're just in classes, and then spring of second year, you have your first integrated clinical experience. And this is a part-time clinical experience, and you'll do it in one of the blocks of the spring semester. And so with this, these are really cool, very unique to our program experiences. And so You'll have the opportunity to, for example, be in the classroom in the morning with Jacqueline Carson, learning about patients with Parkinson's disease and how to treat those patients. Then you could be in the clinic in the afternoon with Jacqueline, working with people from the community that have Parkinson's. So it's a really great opportunity to really immediately apply things that you're learning to patients that you're working with from the community. And so with you have two integrated clinical experiences. One will put you with an ortho clinical instructor, and then one you'll be with a neuro complex medical clinical instructor. Also during the spring, all of our students spend, I believe it's around 10 hours in our New Directions Wellness Center. And so this is a really cool resource we have here for people in the community that have disability, chronic disease or illness, or are older adults. And it's a gym. It's a wellness facility where folks can come in and work out, but it's really geared towards someone who's not going to roll into a regular gym and feel comfortable working out there. Maybe they need more specialized equipment. Maybe they need weight machines that you can roll a wheelchair up to. Maybe they just need extra assistance. And so our students man that wellness center, and it's a really great opportunity to apply your knowledge of exercise physiology, to develop and support folks in their exercise routines that will help maintain their wellness, build their fitness, but aren't your typical kind of, gym goers. So it's really unique opportunity. You also collaborate with nursing students, speech language pathology students, pharmacy students in there as well. So it's also an integrated or an interprofessional experience. Then second summer, so summer after second year, you have another 8-week clinical experience, and you'll do the opposite setting from your first experience. So if you did inpatient in your first experience, in your second experience, you'll have an outpatient clinical experience. And one of the things about our full-time experiences is you will progress in the number of options you have for your clinical experiences and your ability to have a more specialized experience throughout. And we'll talk a little bit more about that in just a minute. Then you come back fall of third year, you have another integrated clinical experience in the UMPT clinic, also spending some time in New Directions. And then spring of your third year, you're off campus the whole time. So you have a 15-week clinical experience. And in this, because you've met that inpatient and outpatient requirement in those first two full-time experiences, now you can be in the setting of your choice. It can be a really pretty specialized clinical as well, if that's what you choose. And so we work really hard and individually with students to identify what are your personal and professional goals for that final clinical, and how can we make the best placement for you. So next slide, Rich. Thanks. So this is just kind of highlighting, these are those full-time clinical experiences that you'll go through. And what you'll see with these is that, again, that kind of increasing specialization and increasing in options. Next slide. So with the first clinical experience, you're going to be in a more generalized experience, and you'll have the fewest options to choose from. So the way that we do this for you all, so those of you that will be joining us in fall of 2024, starting March 1 of this year, we'll start making requests for placement options for you all. And what we do is we work as a team to identify about 40 clinical sites that offer really strong first-year clinicals. We shoot for an even mix of inpatient options and outpatient options as best we can. And so then we provide you all, usually it's around mid-September, we give you this list of 40 sites. And all of the students will choose their top 10 out of those 40 sites. And so you'll make your top 10 list, and then we have a computer system, a program that runs a matching program to take everybody's top 10 and make placements. And so that's why I talk about with that first experience, you have the fewest options. You have those 10 to choose from, and then we use this matching system to make those placements. And those are going to be more generalized experiences because you only have 2 semesters of education underneath you at that point. So, clinical settings like working with pediatric patients or maybe working with folks with pelvic health issues, those are pretty specialized. And at the end of first year, you won't have any of that training yet. So we don't do clinical placements in those settings for first year. Okay? Then when you get to second year, then you'll start to have more options. Okay, so we really then open it up for you to look at all of the 500 plus clinical sites we have and let you start to choose, maybe you want to be in Alaska and you want to do some rural health up there. So we help you identify clinical sites there. So again, increasing options, increasing ability to do some more specialized settings like inpatient rehab, working with folks with new or progressive neurological conditions, right? And then when you get to third year, you have the most options. So third years get kind of their first choice of all of our clinical spots, and you can be most specialized. So right now we have a third year student, and he really wants to work with climbers after he graduates. So he wants to work in outpatient orthopedics and specifically with folks that are climbing. And so I was able to find a clinical placement for him working with a CI who is a certified hand therapist and physical therapist who works with climbers. And so that's a very specialized clinical placement. I also have a student right now who is doing a very broad hospital-based clinical experience where she's doing some acute care, some outpatients, seeing some geriatric patients, some pediatric patients, because she knows that she's returning to her very rural community in Montana and needs to have a really broad exposure to patients because that's who she'll work with. And so we can really start to identify where are you, potentially heading after graduation, and let's find a clinical that can either be really specialized or really broad based off your interest. So again, as you progress through these clinicals, you're going to have that increasing independence in what you're choosing, increasing options, and then the increasing opportunity for specialization. And one last thing about clinicals, it's important for you to know that because of the size of Missoula, we are not able to place every student for every clinical in Missoula. The city's just not big enough. We always want students to know that there is potential that you may have to travel to a clinical site for your clinical experience at least once outside of Missoula. We work really hard, especially with some of our more rural partners, to have them identify housing options, whether it's free housing through a hospital or maybe they have resources in the community that are willing to rent a basement room or something like that to students. So we help you identify housing if that's a struggle for you. So that's one of the ways that we support students, knowing that we can't keep everybody in Missoula for every clinical. Yeah. Thanks, Rob. Oh, I keep going. So the integrated experience is a little bit more about those. So again, spring of second year, fall of third year, either with ortho or neuro complex medical patients. And so one of the unique things about working in these integrated clinical experiences is that we use a collaborative learning model. So you're in a group of 4 students working with one clinical instructor. And so typically in those full-time experiences, it's 1 student with 1 clinical instructor, but in the integrated experiences, there's 4 of you. And then that group of 4 is split into pairs. And so the majority of the time you will be seeing patients with one of your classmates. And so you will identify one of you that's the lead therapist. And then the other student is kind of supporting them. But you're always troubleshooting, problem solving together, thinking together. And so you have this unique opportunity to learn from your classmates, as well as from your patient, as well as from your clinical instructor. And then you also have that time that you spend in the New Directions Wellness Center. And so this is an opportunity to really engage in that kind of wellness and prevention model. Not necessarily, we're not treating impairments in New Directions, but we're really helping patients identify wellness fitness programs that are appropriate for their goals and maybe their particular like disease condition or impairments they might have. You're also engaging in interprofessional collaborative practice and interprofessional education with students from all kinds of different professions, like I mentioned earlier. And so we do these really great intakes on folks coming in where we talk with them about their social needs, medications they take, vital signs. We do cognitive screens to really get a screen for and identify any issues they may have that may be impairing their health, in addition to working with them to develop a fitness program.
Thanks, Jen. Okay, so what I'll do now is I'll kind of go over this morning's schedule. And then I'll also talk about this afternoon's schedule as well, if in case that includes, in case you've decided to tune in this morning. We'll then take questions and then we'll let you go so you can get off to your interview sessions this morning. So obviously we've already done the welcome and our check-in, as well as this is the program overview and clinical education presentations. From there, we'll have you go to your individual interviews. What you can do during this time is if your interview is right away, great. Obviously, go to that. The student breakout room will be open all morning, so you can go ahead and hop into that. You're going to need to follow the hyperlink that is on your itinerary that was sent to you. And again, that student breakout room is going to be we have several students in there working that. The students have been instructed to kind of give you a very honest opinion and experiences that they are having in our program. It is not part of your scoring, and it is confidential too. We've also asked, we don't receive feedback from the students who are in there. So please feel free to ask the questions that you feel that you need answered so that you can make an informed decision when you're thinking about making decisions about schools. The same goes for your individual interview. That is actually a blinded interview, and what that means is that when you are meeting with your interviewers, they don't know anything about you. And so what that means is they have not seen your transcripts, they have not read your essay, they don't know about your clinical observation hours either. And I think that's a real nice part of our interview process, and that our faculty who are interviewing you have an unvarnished view of you, and it's kind of your moment to kind of shine during your interview. I bring that up too because if there's something that's unique about you that you feel makes you a special applicant, make sure that you find a way to work that into your interview today. Then at noon today, if you are interested in one of the dual degrees, there'll be an overview for that. And even if you're just curious about it and want to learn more about it, please tune in and again, follow the hyperlink on your schedule. Of course, all these times are Denver or Mountain Standard Time, and we will be letting our applicants know admissions decisions within 1 week. So we will turn that around quite quickly. So for our afternoon group, we're basically going to repeat what we just did. They're going to check in around 10:45 to 11. We will play the same presentation. Then we will follow that up with questions then at that time point. So if that's you, make sure you're following those hyperlinks. And then same thing, individual interviews and student breakout rooms as well. So okay, so I think what we'll do then is we'll go ahead and take some questions from everyone, and so we can do about answering those. And if we don't get to those, what we'll do is I would then encourage you to ask your faculty during your interview session, or of course ask our students when you get a chance to make it to that breakout room. So I'm going to go ahead and stop sharing my screen and open the floor up for any questions that y'all